rise to speak to the Amendment 152 that appears in my name. I think we've already had a rich and debate concentrated in certain areas. This is a somewhat different area, which is why I wanted to put it at the end. This is an amendment that particularly looks at, we've been talking quite a bit about training, but also about research and the link between the two. And the Noble Lord Scriven, introducing this group, said it was all about autism and learning difficulties, but this amendment actually also covers mental health as well, for the interests of clarity. So what this amendment calls for, and it is a probing amendment, but I do think there is an argument for doing what it calls for, which is 2 years after this bill is passed, and then 3 years thereafter, having a report to Parliament about the provision for and progress in research and the transfer of research findings in mental health and autism and learning difficulties. Now, I think this would both enable Parliament to keep a check on how much resources are being put into this area and how much, crucially, we're seeing the transfer of knowledge into practice. But it would also be a really useful tool for informing Parliament about what is an extremely fast-changing area. And I think it is worth noting that mental health and disabilities are areas in which research is not just redefining our understanding, but often entirely demolishing old models and forcing a restart from the basics. We're also seeing a change in approach in which I'm very pleased to say that there's an increased focus on ensuring that experts by experience are able to guide and have input into research directions in a way that certainly was not true in the 20th century. I note, for example, an interesting study from the University of Stirling from last year, which spoke to people in Scotland, but I have no doubt this applies more broadly, that looked at how currently research in autism tends to be directed towards biological studies and search for treatments and cures. But people, autistic people, were saying that they would prefer a focus on the research on a good quality of life, and that they should have a real say in the research directions. They were concerned that continuing even now, there is in research directions ableism, objectification, and other othering approaches. I spoke in the previous day of discussion about the failure to really apply the social model of disability to learning difficulties and autism, and I think that's very much the case. And hopefully that's going to change, and that's going to change what we should be researching, but also how we should be training people. Now, perhaps on more comfortable ground for many people, I'll note the fact that we have, across many areas of research, a replication crisis, and that's particularly true in the mental health space, where, unsurprisingly, there's been a recent dawning that conducting a great deal of research on US college students does not necessarily produce findings that can be replicated all around the world in all sorts of different research conditions. I note that, for example, when it comes to Alzheimer's disease, amyloid plaques, are they a cause, a symptom, or simply correlated? I have no idea, and I doubt that anyone can hand on their heart say they know either, an area in which we've seen continual failure of medical trials showing our just lack of knowledge. Now, just this week, a really interesting study I've got to point to in translational psychiatry, which found a very close link between the bacteria in our mouths and mental health. I spoke at second reading about the gut-brain axis. These researchers are talking about the oral brain axis. Their analysis found notable differences in the composition of oral bacteria, suggesting the oral microbiome may play a significant role in mental well-being. I note last year there was a study in the UK on avatar therapy for people who hear voices, also known as auditory hallucinations. That was said to provide potentially life-changing results for people with psychosis. They could both reduce the voices heard by an individual and the distress that these voices can cause. This is really interesting breakthrough research using a different kind of technique that, let's say, someone who was trained 20 or 30 years ago is extremely unlikely to ever have been exposed to, and we would hope they're keeping up, but there's so much out there from so many different directions. This is an amendment that really aims to ensure that we've got brilliant researchers making real progress. Let's make sure Parliament knows about that. Let's make sure that it's incorporated into treatment, and let's make sure we're really keeping up, because I think, as we've heard earlier in this group, we're really not at the moment.